So, you're starting a new medication. I get it. It can feel like a lot. If your doctor has just prescribed the BTK inhibitor, well, you've come to the right place. We're going to break it all down and cover the 5 things you absolutely need to know.
So, you've just been prescribed a BTK inhibitor. What now? Well, we're going to walk through the 5 key things you really need to know to get started on the right foot, take your medication safely, and get the best possible results.
All right, let's start with the absolute foundation. This is the most important habit you're going to build, and honestly, it's the easiest one. We're talking about your daily dose.
It really boils down to 2 simple things. First, try to take it at the same time every single day. That consistency is what keeps the medication working at a steady, effective level in your body. And second, always take it with a full glass of water. That helps with absorption. See? Super simple, but so important for your success.
Okay, number 2 on our list, the do not eat list. Now, don't worry, this isn't about some crazy restrictive diet. It's just about being aware of a few specific foods that can mess with your medication. This is all about keeping you safe.
So you're probably wondering, why can't I eat grapefruit? Well, it all comes down to this little enzyme in your body called CYP3A4. The best way to think about it is like it's the processor in your body that breaks down the medication. But some foods act like a roadblock. They block that enzyme. And when that happens, the drug levels can creep up, sometimes to unsafe levels, which in turn amps up the risk of side effects.
So what are we talking about here? The big ones to avoid completely are grapefruit, starfruit, and pomegranate. You also need to watch out for Seville oranges. And here's a pro tip, they're often hiding in marmalade, so definitely check those labels. And the last one is turmeric. You'll want to skip that in your diet while you're on this treatment.
All right, so we've covered food. Now let's talk about what else might be in your medicine cabinet. It's just as critical to look at supplements and other meds you might be taking because a lot of common stuff needs to be handled with care.
So what's the big deal here? The number one thing we're trying to manage is an increased risk of bleeding. See, your BTK inhibitor already acts as a mild blood thinner. So if you start adding other things that do the same thing, well, you can see how that could get risky pretty fast.
And we're talking about really common supplements here. Things like fish oil, vitamin E, even St. John's wort. Curcumin, which is that active stuff in turmeric we just mentioned, is on the list too. And hey, fun fact, St. John's wort actually messes with that same CYP3A4 enzyme we talked about. See how it all connects? Now the point isn't to scare you into stopping everything. It's to make sure you have a really open, honest chat with your doctor about everything you take, even if it seems totally harmless.
Okay, what about a headache? Can you take an Advil? This is a super common question. Here's the deal. Because of that bleeding risk, taking things like ibuprofen or naproxen every day is a no-go. Now, for a one-off ache or pain, it might be okay, but, and this is a big but, you absolutely have to clear it with your healthcare team first. No exceptions.
And this next part is absolutely critical. If you are on any other prescription blood thinners, I'm talking about aspirin, Plavix, Lovenox, you name it, your oncology team has to know. This is non-negotiable. It's a cornerstone of keeping you safe.
All right, let's talk about something that can cause a bit of anxiety. What happens if you have to stop your medication? Maybe for a dental procedure or something else. It's totally normal to worry about this, but being prepared and knowing what to expect is the best way to stay in control.
First off, let's get some perspective. The good news is the huge majority of people, we're talking like 80%, can pause their treatment and have 0 issues, nothing at all. But for that other 20%, that 1 in 5 people who might feel something, it's really important to know what to watch out for.
So if these symptoms are going to pop up, when would it happen? Usually you'd start to notice something within about 2 or 3 days after your last dose. And here's the most important piece of advice I can give you. The second you feel anything off, anything at all, you need to call your healthcare team. Don't wait.
Okay, so what does feeling off even mean? Well, a lot of the time, it feels just like getting the flu. You might get a fever or the chills, some body aches or joint pain, maybe a headache, night sweats, or just feeling really wiped out. The key is to recognize that this might not be the flu. It could be a withdrawal effect. And knowing that is what gets you help fast. And here's the best part. You do not have to just suffer through this. There is a simple, effective solution. These symptoms are super treatable. Usually, a short course of a steroid called prednisone can knock it right out and provide a ton of relief, which again is why it's so important to tell your team right away. They can help.
Now this leads to a really important, kind of serious point. It is vital to understand the difference between hitting pause for a few days and hitting stop for good. If you stop taking your BTK inhibitor permanently and there's no new treatment plan in place, the Waldenström's it's been controlling, well, it will most likely start to progress again.
Okay, for our last point, let's zoom out a bit. Let's talk about the big picture, the long game. What's the goal of this treatment, and what does the road ahead look like?
There's a line from the medical literature that really sums it up perfectly. It says that BTK inhibitors are taken indefinitely or until the occurrence of disease progression or unacceptable toxicity. So what does that mean in plain English? It means this isn't like an antibiotic you take for 10 days. This is a long-term treatment. The plan is to stay on it, keeping the disease in check for as long as it's working and the side effects are manageable.
So there you have it. Those are the 5 big things to know as you get started. Taking your dose right, watching out for certain foods and supplements, knowing what to do if you have to pause, and understanding the long-term goal. You've got the guide now. You're empowered to be an active partner in your own health. So I'll leave you with this. What's the first question you're going to ask your healthcare team?